going to try to talk a lot of the work that we've been doing around the economics of tobacco control over the last 20 or so years, looking globally. I think the evidence that we saw this morning makes it obvious that we know what the health impact is. The industry can no longer dispute the health arguments. So what they've been doing now is really challenging things on economic grounds. So what we've been trying to do is to produce the economic evidence to fight back against those arguments. Talking about the lost productivity, the healthcare costs that are caused by tobacco use, how tobacco use really contributes to poverty, correcting some of the misleading arguments about the dependence of economies on things like tobacco farming and tobacco manufacturing, talking about what's happening with the global tobacco industry. But the one thing we know is that tobacco control is good for economies. Tobacco control makes good economic sense. When taxes go up, tobacco use goes down, but tobacco tax revenues go up. If countries go smoke-free, it doesn't hurt their hospitality industry. We actually see business increase in most places. We have seen countries successfully move away from tobacco growing, tobacco manufacturing, and this all has real economic benefits, particularly in low and middle income countries, particularly in rapidly developing economies. So I'm going to run through some of the evidence that we have in this area. I've been working on this for a long time. Lots of different things that have come out that summarize this evidence. And we're currently in the process of wrapping up a monograph that I spent almost the last 10 years of my life working on with the National Cancer Institutes in the US and with the World Health Organization, really trying to bring together all the global evidence we have on the economics of tobacco and tobacco control. So I'm going to give you a whirlwind tour through some of this, and then you can go and find more details at your leisure. When it comes to the economic costs of tobacco, we know that these are substantial in virtually every country around the world. These are some data from the US. We spend almost $180 billion in healthcare costs every year to treat the diseases that are caused by tobacco. We know that smokers are going to cost more than non-smokers over the course of their lifetime, despite the fact that they're going to die prematurely. And this is a considerable part of healthcare spending in the US. We also know that because people get sick and die prematurely, that we're going to see significant economic losses in terms of lost productivity. So this generates one of the economic arguments for why we should be concerned about this. If we think about the economic costs, they are substantial. And a big part of those economic costs are being paid for publicly. In the US, we don't have much of a public health insurance system, unlike a lot of the other countries in this region. But even in the US, the publicly financed healthcare costs, the costs that are not borne by smokers but that fall on all of society, far outweigh the tax revenues and other revenues that governments are generating from tobacco taxes. Now, if we look around the world, we see the same sort of evidence emerging in low and middle income countries. And again, fairly consistent in terms of tobacco costing healthcare systems and costing overall economies. So you can see the estimates there from China, where they're early in the epidemic. Almost 2% of GDP is lost as a result of spending on healthcare to treat the diseases caused by tobacco use. Given what we know about the patterns that Alan talked about this morning, the epidemic and how it evolves over time, these costs are going to rise rapidly in coming years. The other thing that we've learned is that tobacco really is a key determinant of poverty, a key cause of poverty. If we look around the world, we see that low-income households are spending a significant part of their budgets on tobacco. So this is just a picture looking at how much is being spent by tobacco-consuming households and how much that accounts for by income category of the different countries. What you can see is that even though the absolute amount that's being spent in low-income households is relatively low, it is a significant part of their budgets. We know that tobacco use has become more and more concentrated in the lowest socioeconomic groups in different populations. That's true almost universally around the world at this point. We know that tobacco spending crowds out spending on other household necessities, crowds out spending on things like food and education and healthcare. And we see that that's going to be even more of a problem in low and middle income countries. So these are some of the data we have from the ITC surveys that we've been doing around the world, looking at smokers reporting that they're spending money on tobacco instead of other household essentials. And you can see it's a really big problem, particularly in the lowest income countries. And again, all this leads to this causal relationship between tobacco use and poverty. The crowding out of spending, the fact that people get sick and miss work and then die prematurely, all ends up putting families into poverty. We've seen some good studies from China and India. In China, for example, 50 million households are estimated to be in poverty as a result of tobacco use. When it comes to the economy, the tobacco industry will argue that they have a huge economic contribution, that they make a huge economic contribution to economies. But the reality is that just because there is a tobacco industry present in a country doesn't mean that that country's economy depends on tobacco. What we see is that any reductions in tobacco use tend to be small, they tend to take a long time to occur, and that's going to play itself out pretty smoothly in most economies. The one thing that we do know, though, is that the tobacco industry itself has been the one that's been putting more tobacco workers out of business around the world as they've invested in more and more capital-intensive production technologies that really have very few people involved in tobacco producing anymore. And the one thing that we've seen from a number of different countries is that if governments are concerned about the job losses in the tobacco sector, they can take part of their tax revenues and help people make transitions into other sustainable livelihoods. So we've seen Turkey, for example, a really good example of a country where they've taken their tax revenues, helped Turkish tobacco farmers move into other activities. When it comes to tobacco control and jobs, we actually see that tobacco control is good for employment. Tobacco control creates jobs, not just the jobs of the folks in this room, but it creates jobs throughout all sectors of the economy. When people stop consuming tobacco products in response to tobacco control policies, the money that they used to spend on tobacco doesn't disappear from the economy. They buy other goods and services. That creates jobs in other sectors. When governments raise taxes, they get new tax revenues. They spend those tax revenues. That creates other jobs. And what we end up seeing in most economies is a significant increase in jobs as a result of the reductions in tobacco use that happen because of tobacco control. Same basic story. You hear about all the negative economic things that are going to happen if governments adopt smoke-free policies. Again, the evidence is really, really clear from countries around the world. When smoke-free policies are adopted, they have relatively little impact on the drinking patterns, the dining out patterns of smokers, but non-smokers like them, and there's usually a lot more non-smokers in most countries than there are smokers. And what you end up seeing is typically a net increase in economic activity in the hospitality sector. One thing that's of a lot of concern to me, Terry mentioned it, is the globalization of the tobacco industry and what the implications of that are. I think we're all aware of what's been happening around the world. We've seen a number of different trade agreements that have really opened up markets that used to be closed to some of the multinational tobacco companies. These are happening globally. These are happening at the regional level. They're happening between different countries. And what we've seen is as a result of the markets opening up, we've seen increases in tobacco use, particularly, again, in the low and middle income countries. We've also seen a significant change in investment patterns. We've seen, again, the multinational tobacco companies moving in, investing in new production capacity in a variety of different countries as the barriers to direct investment have gone down. We've seen a lot of the national tobacco monopolies that governments used to run sold off to the multinational tobacco companies. We've seen tobacco companies enter into joint ventures with the remaining monopolies, like the Chinese monopoly or the Vietnamese monopoly. And then we've seen the tobacco companies also buying one another and merging where they don't have that sort of direct acquisition. So again, the industry is becoming much, much, much more concentrated over time. What we have now is a global tobacco market that's really dominated by 5 companies. If we look at what's happening, the same sort of activity is going to continue. The second and third biggest tobacco companies in the U.S., for example, are in the process of merging right now. And the top 2 companies will end up with 80% market share after that happens. The other thing that's of interest and concern is the fact that the companies have expanded their product lines. So cigarette companies used to be cigarette companies, smokeless companies used to be smokeless companies, but now we have companies that pretty much provide every different type of tobacco product that you can imagine. And they've also moved into the nicotine business as well, so producing lots of other sorts of nicotine products. We've seen tobacco companies marketing their own smoking cessation products, which doesn't seem like a good thing. If you start to look at some of the advertising that they're doing, it looks like it's a pro-tobacco use ad rather than a smoking cessation ad. But what you end up seeing is that companies have very, very diverse product lines. They brand the products across these different product lines. They market these products as ways of getting around tobacco control policies. So a lot of the smokeless products, the dissolvable products in particular, are marketed as a way to maintain your nicotine addiction when you're in an environment where you can't use tobacco, or you can't smoke. And then the big one in the US, and not so much in this region, is what's happening with the electronic nicotine delivery systems. Again, being marketed as a way to maintain your addiction, not to have to quit smoking, to be able to continue to smoke in places where you're not allowed to smoke cigarettes. And then the other big concern in this area is as they get more and more market power, these companies are using this market power to challenge national tobacco control policies. So you see this happening at every level. We see within countries, companies going after national tobacco control policies. We saw it happen in Norway with their tobacco product display ban, the graphic warning label efforts in the United States a couple of years ago. We saw them try to do it here in Australia with the plain packaging. Under the investment treaties, we see what are known as investor-state disputes, and these are where the companies themselves are taking advantage of these investment treaties and using them to go after tobacco control policies. So one of the ones that I'm spending a lot of my time in is the bilateral investment treaty dispute between Australia and Philip Morris over the plain packaging efforts. And then I think the one that's probably the biggest concern are the state-state disputes that come under the different trade agreements. So again, I'll be in Geneva next week helping to defend the plain packaging measures here in Australia against the challenges under the trade agreements, the international trade agreements there. The good news, thank you for that. The good news is, and I think we're going to win, the good news is that the tobacco industry may be globalizing, but tobacco control is also globalized. So we have things like the Framework Convention on Tobacco Control. We really are spreading the lessons about what works to reduce tobacco use through things like the FCTC, through the Empower package, which pulls out the key provisions of that treaty. So I am optimistic that the industry, while the industry is growing, that the tobacco control movement is as well, and that we'll have success going forward. I can't do a talk without talking about tobacco taxation. This is my favorite policy. This is the one that I think we have the best evidence on, the one that we know really works to reduce tobacco use. Here's a quote from the Director General of the WHO talking about that Empower package and talking about how tobacco taxes are by far the most effective policy we have for reducing tobacco use. We know when taxes go up and when prices go up, overall tobacco use goes down. This is a picture from New Zealand that illustrates that. So when prices have increased because of tax increases, particularly in recent years, we've seen the reductions in tobacco use. When prices weren't going up, you can see that those reductions in tobacco use pretty much slowed down or disappeared. We know that about half the effects of tax works through its impact on smoking prevalence. So a number of people will not use tobacco as a result of the tax increases. I heard somebody was here from Brazil. Here's the picture from Brazil when the Brazilian government raised its taxes and prices as part of its tobacco control strategy. We see the reductions in prevalence that have followed that. The reductions in prevalence happen because people quit smoking in response to the increases in taxes and prices. Some data from the US that illustrates the interest in quitting that follows tax increases. So what we see here is calls to our quit lines, cessation quit lines in the US. When we've had big tax increases in states, we see a lot of smokers get interested in quitting. And then when we had our big national tax increase 6.5 years ago, the last one, we see the real spike in those calls to the quit lines. And then eventually smokers who try to quit will succeed. One of the things that we see in the US is in the states that have the highest taxes, the highest prices, we have many, many more former smokers. So a lot more smokers who have succeeded in quitting smoking. A lot of my work is focused on kids' tobacco use. We know that kids are much more sensitive to price than adults are, somewhere around 2 to 3 times more responsive to price. And price really matters when it comes to keeping them from moving beyond experimentation and into more regular tobacco use. So when they're experimenting, they're not buying their own cigarettes or seeking them from their parents or getting them from their friends. But when they start to become regular tobacco users, start to buy cigarettes, they start to realize how much they cost, and that's where it really keeps them from moving on and becoming addicted. So we see that again in the data from the US. As prices have gone up, cigarette smoking rates among kids have come down. And we had a period back in the early 1990s when Philip Morris and all the other tobacco companies cut their prices, and that really contributed to the rise that we saw in youth smoking in the late 1990s there. The work that we've done shows that demand for tobacco in low and middle income countries is at least as affected by price as it is in high income countries. And in most countries, it's probably a bit more affected by price. So in high income countries, we estimate a 10% price increase reduces overall consumption by about 4%. In low and middle income countries, most of them it's going to be somewhere around 5 or 6% and more in other countries. And again, you can see this. The basic laws of economics apply just like the basic principles that we talked about this morning on the health effect. When price goes up, consumption goes down. It doesn't matter what country you're in. Just the extent to which it affects consumption is going to vary across countries. We also know that within populations, it's low-income populations that are the most responsive to price. So when tax and price go up, people who have relatively limited incomes, this is going to have a bigger impact on them, basic economics, and that's going to lead to bigger changes in their behaviors. So this is a picture from Turkey. Turkey is one of the world's leaders in tobacco control at this point. Turkey got out of the tobacco business. They used to have a monopoly not that long ago. And then they got into the business of tobacco control. They've met the sort of the highest levels of achievement on all the WHO Empower policies. And part of that has been to push up tax and push up price over time. So they have some of the highest taxes as a percent of price in the world. And when they've done that, they've actually most significantly reduced tobacco use in the lowest income population to the point where the amount that the low-income consumers are paying in taxes has actually gone down over time, so that the burden of the tax increase has fallen on higher income populations. But a very progressive policy, both in terms of its financial impact and its health impact. The other thing that's become apparent is that affordability is a key concept. So we've been looking at countries where it doesn't seem like price matters. So China is a good example, where incomes have grown very rapidly. Taxes and prices haven't really changed that much over time. So cigarettes have gotten a lot more affordable. So if we're really going to accomplish our public health goals with tobacco taxes, taxes and prices need to rise faster than incomes in order to reduce affordability. So Bangladesh is a country where this has been pretty obvious in some of the work that we've been doing. When cigarettes became more affordable, consumption was going up. In the past, when cigarettes got less affordable, consumption actually went down. So we've looked around the world at what's been happening with affordability and how that's been changing over time in different countries. And in this region, in the Oceania countries, those are the ones that are highlighted in brown there. And you can see that there's been some places where affordability has really gone down over time. Those are the bars above the graph, above the axis. Places like Australia and New Zealand, because of the regular tax increases, relatively modest growth in incomes, we've seen big reductions in affordability. But we see a number of other countries where affordability has actually increased pretty sharply. So a lot of room for increasing taxes in these countries. And then again, at the end of the day, because of the reductions that we get in tobacco use, we see real improvements in population health. So this is a picture from Prabhat Jha that looks at the situation in France. France decided in the 1990s it was going to take on tobacco use, started by pushing up taxes and prices, and immediately you see the reductions on the red line in consumption of cigarettes. And then within a few years, we start to see some of the health benefits kicking in terms of the reductions in some of the cancers that are being caused by tobacco. And then the last thing here is that tobacco taxes, even though we get all these reductions in tobacco use, actually raise more revenues. So when you increase the tax, revenues go up. This is a picture from South Africa where they've been doing that steadily over the last 20 years. And you can see every time the tax has gone up, price has gone up, consumption has come down. But at the same time as that's all happening, revenues have been going up. And then the other thing we know is that when those revenues get put back into tobacco control efforts, we see bigger reductions in tobacco use. So that's a key thing, is to make sure that some of those revenues actually go back for the purpose that the tax is being increased. Here is a picture from the U.S. We've looked at the state tobacco control program funding in the U.S. Some states take part of the revenues, put them into comprehensive tobacco control programs, and when they've put more money into those programs, we've seen even bigger reductions in youth smoking. We see the same effects for adults. We see the same effects on overall consumption. A couple of comments about tax. I've learned over the years that it's not only important to tax tobacco products, it's also very important in thinking about how these products are being taxed. If we look around the world, we see that there are very different types of systems being used in different countries. Many countries levy what we call a specific tax, so a tax based on quantity or based on weight of tobacco products. A number of others levy what are known as ad valorem taxes. These are the taxes that are levied based on price. And then some countries use a combination of the two. And then we have a number of countries where they don't rely on excise taxes, they rely more on import duties to affect price. We also see some really complicated tax schemes in different countries where they tax the same product at different rates based on different factors. Indonesia has the most complicated system in the world at this point. Different types of combustible tobacco products are taxed differently. The taxes differ based on who produces them, so small producers pay a lower tax than larger producers. Products that are cheaper pay a lower tax than more expensive products. So what we end up with is this really complicated system that makes it easy to avoid the taxes. and makes it easier for consumers to trade down in response to tax increases. So the one thing we've learned is that it's really specific taxes, uniform taxes, same tax applied to all products, that's going to be most effective in reducing tobacco use. We see that those are the tax structures that lead to the highest prices. So again, they reduce the variability in prices, they reduce the availability of cheap products in particular, and it's those higher prices then that are going to be more effective in reducing consumption. The other thing that we've been working on is trying to come up with some benchmarks as to what governments should set their taxes at. So we've been talking a lot about the appropriate tax levels. Back when we did the World Bank work, before I recognized the importance of excise versus sales taxes and things like that, we talked about all taxes accounting for somewhere between 2/3 and 4/5 of retail prices. But we went back and revised that a few years ago with some work with the WHO, where basically we were recommending that countries focus on excise taxes. These are the taxes that really differentiate tobacco product prices from other product prices, and that they set those taxes so that they account for at least 70% of the price of tobacco products. If we look around the world, we see that we're a long way from getting to that benchmark. A lot of variability across countries. High-income countries tend to have higher taxes, they have higher prices. Tax accounts for a larger share of price in those countries. Then you can see it pretty much falls off as you move across the different income levels. But at this point, we're about 45% of prices accounted for by these excise taxes. So again, a lot of room before we get to that 70% threshold. If we look within this region, we see that there's room for progress in pretty much every country in the region at this point. So very few countries have gotten even to the World Bank target that we talked about, the 2/3 of price for all taxes. So again, fair amount of room for improvement here. And we know that the tax directly affects price. So the countries that have used tax more aggressively to try to curb tobacco use do have the highest prices for tobacco products. The industry knows that price is important as well, so they have their own pricing strategies to try to offset some of the effects of taxes on tobacco use. So their lobbying strategies, their discounting strategies really get at some of this. I blame economists for this picture. So this is a picture from the US. What we're looking at here is how much tobacco companies have spent on marketing their products in the US. And I've broken out the marketing into different types of marketing. So the red part is advertising, the sort of traditional image-oriented advertising. There's things like product placement fees that they pay to retailers and so on, some of the branded merchandise that they give away. The key takeaway here is that green parts. In the US, about 5 out of every $6 spent to market cigarettes is spent to reduce the price of tobacco products. And you can see the shift in this all really started to happen in the early 1980s. That was when the first economic studies started coming out, talking about how important price was in reducing tobacco use and how important it was, particularly in reducing use among kids. So the tobacco industry got that message and has increasingly concentrated its efforts in reducing price. They'll also do a lot of other things to try to avoid the impact of the tax. So this is a picture from the Philippines. In the Philippines, they went through a significant tax reform a couple of years ago, pushed up their cigarette taxes considerably, are using the revenues from that to finance a national health insurance program, universal health care program. But what you can see that they didn't set up a tax where they would tax the inventories that retailers and wholesalers were holding. So the industry tries to avoid some of that tax increase by shipping a lot of products before the tax actually goes into effect. And you can see the big increases in leading up to the months where the tax happens. So the tax goes into effect in January. You can see the increase later in the year before that, and then the drop afterwards. So again, they can help spread out the impact of tax over time. The other thing that we're starting to pay a lot more attention to is how they're passing taxes on with different prices. This is a picture from the UK, but we're starting to see the same thing happening in other parts of the world. So they're really overshifting tax, pushing up prices by more than the tax at the high end of the market, the less price-sensitive consumers, capturing profits from them. But they're really using that to subsidize not pushing up prices at the low end of the markets. So again, the sort of different strategy for passing through to try to keep some products cheap for the most price-sensitive consumers and then capturing whatever profits they can from the most price-sensitive consumers. The last thing I want to talk about is just the issues around tax avoidance and tax evasion. The industry makes a lot of arguments about how if you raise tax, that's going to lead to a lot of illicit trade in tobacco products. This is actually an argument that's now come up in the context of other tobacco control policies. So we're hearing about it in the plain packaging challenges. They argue that plain packaging is going to make cigarettes easier to counterfeit, and you're going to end up with a flood of counterfeit cigarettes. They've talked about it around graphic warnings and around various other policies. A few basic points here. Even when there is a lot of tax avoidance and tax evasion, we still see real public health and real revenue benefits from tax increases. This is a picture from New York City. New York City has the second highest taxes in the US, $5.85 a pack at this point. They've been pushed up, you can see over time on the red line. About half the cigarettes that are consumed in New York either avoid or evade the cigarette tax, the local cigarette tax. But we can see that as cigarette taxes and prices have come up, we've still seen reductions in youth tobacco use. We've still seen reductions in adult tobacco use. Not as big as if we didn't have that problem, but still happening. Same thing on the revenue side. This is from Chicago, where I come from. We have the highest taxes in the country. And what we see is that as those taxes have gone up over time, despite the fact that we have the same sort of problems as New York with illegal cigarettes, we still see real increases in revenues. So the bottom line is that it's not price that really drives the illicit trade, it's a lot of other factors. This is a picture that just looks at the market share for illicit cigarettes in different countries around the world, and then looks at price across the horizontal axis. So the idea here is if it was really price driving illicit trade, then you would think that the countries with the high taxes and high prices would have the biggest problems. It works exactly the other way around. It's the countries that have high taxes and prices that have some of the lowest levels of illicit trade in the world. That includes countries in this region, New Zealand, Australia, some of the highest taxes and prices in the world, very little illicit trade. So there's other things that are really driving this phenomenon, and I go to the strength of governance in countries. So countries that have good tax administration, that are effective at controlling their borders, that don't have a lot of corruption, these are the countries that are really successful in dealing with illicit trade in tobacco products. The countries where that's not true, those are the countries where we see the biggest problems with illicit trade. So that just shows up on this graph. Same basic measure of the market share for illicit cigarettes. Now we're looking at a measure of governance, the transparency index. So again, countries with strong governance have relatively little illicit trade in tobacco products. And then the bottom line is if governments really are concerned about this, they have tools that they can use to address it. So when they take a comprehensive approach to dealing with illicit trade, we see that they can get rid of that problem. So this is a picture from Spain. I like this one because they used to have some of the lowest taxes and prices in Western Europe, but they had some of the highest levels of illicit cigarettes in their markets. So about 1 in 5 cigarettes consumed in Spain in the early 90s was somehow either avoiding or evading taxes. And what the Spanish government decided to do was to really take this on. They cracked down on the large-scale smuggling in particular, much more aggressive enforcement efforts, much stronger penalties. They worked with their neighbors to make sure that they got control over their borders. And what you can see is over time, they basically got rid of the problem, reduced it to almost meaningless levels, down to 1% recently. And at the same time as they were doing that, they were able to push up their taxes and push up their prices. So again, if countries want to deal with this, they can do it effectively. The principles that have been learned from Spain, from the UK, from Canada, from Brazil, from a number of countries around the world that have really tried to deal with these problems are all embedded in the illicit trade protocol to the WHO's FCTC. So strong tax administration, taking advantage of the technologies we have for tracking and tracing tobacco products as they move through the distribution process, really focusing on enforcement and setting high penalties are going to be essential. So the disappointing thing here is that almost nobody's ratified. How many countries in the room have ratified the illicit trade protocol? 1, all right. So we have a long way to go. So I think we need 40 countries to ratify before this comes into force. There are 9 so far. So one of the things that y'all can be, 10? We got 10 now, all right. So something's happened in the last week. So that's good news. We're a quarter of the way there. So we just need to keep pushing forward. I think one of the things you all can do is go back and try to get your governments to move forward with this. So countries like Australia has, despite the leadership in other areas, hasn't gone ahead and signed the treaty or ratified it yet. So again, to summarize all this, we know that there are big economic costs associated with tobacco use. We're talking about the healthcare costs, the lost productivity costs, the increases in poverty, and we know that tobacco control is actually going to be good for economies. Tobacco control interventions, I'll show you in a second, are highly cost effective, and it's really tobacco taxes that are the most cost effective of these strategies. So we've been doing some work as part of this monograph to look at the cost effectiveness of tobacco control interventions. What we see is that the big policy interventions, highly cost effective. They cost relatively little to implement. We know that they work in terms of reducing tobacco use, particularly cost-effective in some of the lower-income countries. And even the one that doesn't look so cost-effective, cessation therapies, when you put it on, when you can start to compare it to other public health interventions, it's actually very, very cost-effective relative to them. So again, a pretty quick overview of a lot of the things that we're doing around the world in the economics of tobacco control. But you can find out a lot more if you go to our website, Tobacconomics, where we're putting all this research out. And you can follow us on Twitter if you do that, and you can follow up with me on email. Thank you.